Hello everyone, and thank you for viewing our webinar. Our webinar is over occupational stress of a 911 dispatcher. In this webinar, we will inform you on the following: defining occupational stress, the job role and functions of a 911 dispatcher, identifying work and non-work related stress factors, the physical and mental implication as a result of stress, resources and tips to reduce 911 dispatcher stress. What is occupational stress? Occupational stress is defined as the endless or progressing stress an individual experiences due to work conditions, the environment, pressure, or job responsibilities. What does a 911 dispatcher do? The 911 dispatcher questions the caller to determine their location and nature of their emergency. They receive incoming telephone calls, whether that's non-emergency or emergency, and it's usually regarding the need for fire, police, or EMS. They determine the proper response type by prioritizing situations based on their seriousness. They record details of all calls, dispatches, and messages. They retrieve and enter data from teletype networks as NCIC and computerized data systems like their computer-aided dispatch. They contact emergency responder field units to determine their availability for dispatch prior to dispatching a call to them. Work and non-work related stress factors. Pre-employment and probationary period stress, inadequate and or broken equipment, poor management, inconclusive nature of dispatcher work, personal finances, work and life imbalance, health concerns. The most common work-related stress factors: pre-employment. The hiring process can take months, and it consists of several tests that can include, but are not limited to, a critical test, which is a multitasking test for your ability on being able to dispatch, remembering mapping functions, listening to license plates given and typing it in again, as well as taking the most direct route on a mapping system to give instructions to your first responders. You can also be given a polygraph test, most commonly known as a lie detector, a urine analysis, a background check, which can even include interviews with family, friends, or neighbors, and fingerprinting. Our second factor is going to be probationary period stress. When someone is hired for the 911 dispatcher position, you are considered a temporary telecommunicator for 6 months up to a year, depending on your performance. For example, the more experienced people or someone who may have worked as a dispatcher in the past might only be on the probationary period for 6 months. Someone who has never dispatched before and is their first time could possibly be under a temporary employee on the probationary period for up to a year. Inadequate and or broken equipment. Poor quality headsets, malfunctioning radio equipment, and broken desk or chairs. So as we said before, you need your desk to be able to go up if you want to stand, or go all the way down if you want to sit in your chair. A lot of times those motors burn out, and they're not always fixed in a timely manner, as well as the malfunctioning radio equipment. If you can't properly communicate with the units that are responding to the calls you're dispatching, it's going to create stress on the job. Same goes for their headsets. Poor management is a stress factor in the working field. The lack of support from supervisors, managers, and chiefs, extended unplanned working hours, as well as no breaks given between shifts. To elaborate on that, you can be scheduled anywhere from an 8 to 12-hour shift. If somebody calls in on the following shift or the shift before you, you may be asked to cover an additional 4 hours, either prior to your shift or at the end of your shift. Dispatchers work for the full time. You take your lunch break sitting at your desk taking calls. There is no hour off the clock lunch break for a dispatcher. The most common non-work related stress factors: personal finances. A lot of dispatchers are underpaid in their careers, resulting in an individual having to obtain a second job. Work and life imbalance, the extended hours within a working shift, and you must be flexible in your availability to be able to cover those shifts when necessary. Health concerns. Dispatchers have a higher risk of suffering from hypertension, diabetes, high cholesterol, and insomnia. The physical and mental implications that occur from stress. Musculoskeletal disorder, known as MSD, excessive weight gain and or loss, gastrointestinal problems, post-traumatic stress disorder, commonly known as PTSD, impaired judgment, and increase the chance of substance abuse and addiction. The most common physical implication caused by stress is going to be MSD. MSDs are a soft tissue injury typically caused by a sudden or sustained exposure to repetitive motion, force, vibration, and awkward positions. They can affect the muscles, nerves, tendons, joints, and cartilage in the upper and lower limbs, neck, and lower back. Some effects of MSD include carpal tunnel syndrome, eye and hand coordination, back pain, as well as headaches. The most common physical implication caused by stress: constant weight change, excessive weight gain and or loss, gastrointestinal complications, which is a condition involving constipation, irritable bowel syndrome, hemorrhoids, and perennial infections. The most common mental implication caused by stress is going to be PTSD, which is defined as an indirect exposure to someone else's traumatic experience. Duty-related trauma puts dispatchers at risk for developing PTSD. PTSD occurs when people handle calls that are particularly distressing or upsetting and that stick with them for a long period of time. Impaired judgment. Impaired judgment is a medical condition that results in a person not being able to make good decisions because of an underlying medical problem, environmental factor, diet, or use of drugs and alcohol. It is often accompanied by impaired social skills, impulsive or inappropriate behavior. Substance consumption. Increasing consumption of drugs to calm the stress level, leading to drug abuse. Resources and tips to reduce on-the-job stress. Employee assistance programs are known as EAPs. Stress, the acronym stress self-care. Improving work equipment. The EAP programs are designed for incumbents being encouraged to seek service through the Employee Assistance Program, also known as EAP. EAPs are designed to help employees with emotional and substance use issues interpersonal relationships, legal problems, and finance difficulties. This program is completely voluntary without any additional cost to the employee. Individuals can choose their preferred service, which can be conducted through the phone, video-based counseling, online chats, email interaction, or even face-to-face. The acronym STRESS for self-care. S is for sensible eating, T is for time to enjoy life, R is for rest and relaxation, E is for exercise and education, S is for social support of family, colleagues, and friends, S is for satisfying expression of self and spirituality. Improving work equipment. It is recommended that the organization improve work equipment used by dispatchers to complete job functions. Dispatchers should use modern digital headsets rather than the traditional analog, which offers the quick disconnect capability. Monitors used by dispatchers should have adjustable brightness and contrast and should also be height adjustable, as well as their desk. This is a life of a 911 operator. Thank you for your time, and we hope you enjoyed this presentation.